The Prime Minister, in an address to the nation, has announced booster doses for all those above the age of 60 and frontline healthcare workers. This was a long-standing demand by frontline healthcare workers that Prime Minister Modi has paid heed to. Vaccines for the age group of 15 to 18, crucially, have also been approved. These vaccinations will be given from the 3rd of January. The Prime Minister has called it precaution doses for healthcare and frontline workers and all those above the age of 60. These individuals will be, remember, given their booster doses or precaution doses from the 10th of January. Crucially, Prime Minister Modi has also announced yesterday that a nasal vaccine is going to begin in India very soon. Meanwhile, the drug regulator has cleared Bharat Biotech's Covaxin for the age group of 12 and above. So this is the vaccine that will be administered to the 15 to 18 age group for now. The Prime Minister has asked people to remain alert. In his message to the nation yesterday, he said Omicron is spreading, but there was no need to panic.
15 साल से 18 साल की आयु के बीच के जो बच्चे हैं, अब उनके लिए देश में वैक्सीनेशन प्रारंभ होगा। 2022 में 3 जनवरी को सोमवार के दिन से इसकी शुरुआत की जाएगी। ये फैसला कोरोना के खिलाफ देश की लड़ाई को तो मजबूत करेगा ही, स्कूल कॉलेजों में जा रहे हमारे बच्चों की और उनके माता पिता की चिंता भी कम करेगा। जो कोरोना वॉरियर्स हैं, हेल्थ केयर और फ्रंटलाइन वर्कर्स हैं, इस लड़ाई में देश को सुरक्षित रखने में उनका बहुत बड़ा योगदान है। वो आज भी कोरोना के मरीजों की सेवा में अपना बहुत समय बिताते हैं। इसलिए प्रिकॉशन की दृष्टि से सरकार ने निर्णय लिया है कि हेल्थ केयर और फ्रंटलाइन वर्कर्स को वैक्सीन की प्रिकॉशन डोज भी प्रारंभ की जाए। इसकी शुरुआत 2022 में 10 जनवरी सोमवार के दिन से की जाएगी।
All right. Well, to understand more about these big announcements that the Prime Minister has made, Dr. Subhash Salunke, member of the National Task Force for COVID, joins us. He's also senior advisor to the Public Health Foundation of India. Thanks very much, Doctor, for being with us. We also have Dr. Vivek Nangia, Principal Director and Head of Respiratory Critical Care Medicine, Max Sake, joining us from the National Capital. Thank you both very much for being with us. Dr. Salunke, to you first. Long-standing demand on booster doses, especially for frontline healthcare workers and the vulnerable population, has finally been met. The Prime Minister has called this quote-unquote precaution doses. Your first reaction?
I'm extremely delighted that the Honorable Prime Minister has ultimately agreed and announced to what is being requested for last 3-4 weeks by public health specialists like us and all the doctors. And even though it is delayed by a couple of weeks, had it been done fortnight back, it would have been much better, but doesn't matter. There is ayat durust hai. So I personally feel that this is a very, very positive step. And at the same time, this precautionary dose or precaution dose, you can quote any nomenclature. The fact remains that we need to protect people, particularly who are most vulnerable. Healthcare providers or healthcare workers, senior citizens with comorbidities, immunocompromised patients, etc., etc. And this was known. Now, whether you are going to get, another vaccine, what type of vaccine, these are all the matters of detail.
Okay.
Personally, I feel right now we should be able to use whatever available at this juncture and start early. Like it has been announced that from 3rd Jan, we are considering children's vaccination. We are considering from 10th Jan, ASAP, earlier the better. You can develop vaccines, you can have additional kinds of vaccines. Do that by all means. We have capacity, let's do that. But let's not delay. We need to do it yesterday, because we have to appreciate that even though Omicron is going to be a large number of cases likely to be in India,
Right.
even though it is expected that it may not be that virulent, however, we don't know how it is going to,
Okay.
what role it will
So
play in India.
you're saying essentially der aaye durust aaye, and why even wait till the 10th of January? We should
That's
begin.
right.
We should have technically begun this yesterday. That's an important point that you make. But a couple of very basic questions for the understanding of our viewers, so we can decipher some of these announcements that have been made. Dr. Nangia, which vaccine? For all of those people who've been given Covishield, will they be getting a booster shot of Covishield? For those who've been given Covaxin, are we going to be mixing vaccines? What vaccine are people going to get? Do we have clarity?
So this is exactly, I think, what we are looking forward to now, to understand that which vaccine to be given.
Okay.
If you look at the international studies, they've actually shown that mixing and matching the vaccines actually gives a better immune response as compared to the same vaccine being given the third time. Whether we look at Covishield being followed by Pfizer, Pfizer being followed by Moderna, Moderna being followed by some other vaccine, they've all shown that when it's a cocktail of the two vaccines that is used, the immune response is definitely better. So I guess we'll have to still wait for instructions and studies,
Right.
or an advisory to be coming from AIMS or ICMR or one of these kind of institutes to guide us on that as well.
Okay, so no clarity yet on whether individuals who've been given both doses of Covishield will be given Covaxin as a booster, or what really the strategy is going to be. AstraZeneca, remember, about 48 hours ago had released a study saying 3 doses of the AstraZeneca vaccine are, give a better protection against Omicron. So are those individuals in fact going to be getting the same vaccine? We don't know that just yet, so we'll watch out for that information. But Dr. Salunke, the other big announcement which has been made is again a long-standing demand to begin vaccinating our children, the younger population. So far we're beginning with just the 15 to 18 age group, but the vaccine, Covaxin, has been cleared for 12 and above, so one hopes that that vaccine base will also be expanded. But a couple of questions, as parents who are concerned, and many parents will have many questions before they go out and get their children the vaccine. What is the data? We still don't have clarity from Covaxin on what is the data when it comes to the vaccine efficacy against kids.
Well, I think the one thing is absolutely certain. Let us be very clear that the moment WHO and also DCGI has given the clearance to Covaxin for children between 12 to 18, there should not be any doubt as far as whether you have that kind of data. Yes, the data is available. It is with the DCGI. Without that data, I am 100% certain DCGI will never agree to give permission. So one, it is safe. Two, it needs to be given. As a matter of fact, I am little, amused. Why 15 to 18? Why not 12 to 18? 12, because it is already cleared to 12. As a matter of fact, I was looking very keenly forward to give vaccination to my granddaughter who is 13 years old.
Right.
Even though she has suffered from infection, but I am very keen that I would like to give the Covaxin for children for my granddaughter also. I am pretty sure, and I wish to, through your media, tell the parents, grandparents that the data, in spite of whatever the gaps may be, the safety as far as Covaxin is concerned, which is definitely used for younger generation even earlier. So don't worry, Covaxin will play a very important role.
So essentially what you're saying, and Dr. Nangia, if you want to weigh in here as well, is that there is no questions about the safety profile of Covaxin for kids. But, do you think that because we're looking at vaccinating children, parents, of course, are going to have a lot more questions and concerns, that we need to come out with peer-reviewed data on how exactly Covaxin works when it comes to kids?
See, first of all, I think we need to consider this as a very welcome move from the Honorable Prime Minister to be having extended the vaccination coverage to our children as well. This is something that we all have been looking forward to for a long time now. In fact, there would be nobody in the medical fraternity who would actually stand up against it, because children are very vulnerable. Children, we may think that they develop only a mild illness, but a small percentage of them may go on to develop neurological complications.
Yes.
They may develop multi-organ inflammatory syndrome, which can be life-threatening and could have long-term repercussions on children also. So rather than worrying about the side effects, it's important to go ahead with the vaccination. I'm sure DCGI has given an approval only after diligent review all the data that was available.
But the question is, does there need to be more transparency when it comes to that data? Does the data need to be made public? Does it need to be peer reviewed and put out in the public domain? That's the question. But Dr. Salunke, very last question to you, before we wrap up. There are also many studies that suggest that after getting 2 doses of either Covaxin or Covishield, perhaps an mRNA vaccine is a better choice for booster doses. But there is still no mRNA vaccine available in India, none, in the pipeline, none in sight. How would you look at that?
As a matter of fact, as Dr. Nangia has clearly indicated that, there are, issues which have been raised, whether, earlier Covaxin or Covishield and followed by mRNA, other vaccines, or now which is being discussed as the DNA vaccines, they are all being postulated. I don't think there is any concrete and categorically saying that, okay, 1, 2 and follow third this one. That is not there at this juncture, even globally. So I personally feel whatever available within India, let us go ahead. Okay. Let's not wait for mRNA. As and when it will come, as and when the DNA vaccine will be developed, okay, let us use it. But the weapon which is in your hands, let us make use of it for our protection of our children, protection of the senior citizens with comorbidities, frontline workers, health workers. Let's do that.
Just for point of clarity, Dr. Nangia, if I can bring you in here, if you look at the way India's vaccination coverage has been so far, more than 80% of our population has been given Covishield, which is the AstraZeneca vaccine. Now, like Dr. Salunke was pointing out earlier, that there are studies to suggest that a cocktail of vaccines is something which is recommended. Can we afford to do that cocktail given the fact that 80% has been given Covishield? Would we have the requisite doses to be able to mix Covishield and Covaxin, or do you reckon that it's probably going to be the same booster shot when it comes to the third dose as well?
So, rather than going on to speculations, I think we should just wait for some studies to come in. I understand there are studies underway with the ICMR, and the results should be available to us by, I think, first or the second week of January. Probably that is why there's been a delay in the date for starting the vaccination in the frontline workers also.
Okay.
So I'm quite sure and hopeful that we'll get some result and some data by then to be sure as to which vaccine is to be taken as a booster dose.
All right. Well, big questions on which vaccine is going to be taken as a booster dose, and one needs those answers sooner rather than later, especially since now the Prime Minister has come out and announced doses. But like both the doctors said, it's a big announcement, a welcome one indeed. And why even wait till the 10th of January? We should have begun this yesterday. But thank you both very much for joining us with your perspective on this big story.